Think we're ready to get started. Hello and welcome everyone to Women's Health Tech Wednesdays. My name is Nina Joshi, and I am so excited about our guest today, Aashima Gupta, who is the Director of Global Healthcare Strategy and Solutions at Google. Before we jump in, wanted to give a very quick background on myself. I work as a consultant and design researcher at Kaiser Permanente's Health Innovation Shop, where I design and deploy digital health products and solutions. Wanted to also make a few quick announcements this morning. So the first is that we have our Women's Health Tech Challenge on December 17th, and applications are still open until the 20th of this month. So make sure you go ahead and apply if you are interested. We also have two research studies that are open for participants. The first is for treatment for breast cancer with Blue Note Therapeutics. And the information for all of this is also available in the chat if you are interested. And the second study that we're looking for participants is with Curio, and they are recruiting for participants who have given birth in the last 4 months. And once again, all of that information will be in the chat. All right, great. And with that, would like to formally introduce Aashima Gupta, who's the Director of Global Healthcare Strategy and Solutions. Hello, and thank you so much for joining us today.
Well, thank you, Nina, and thank you for hosting me, HITLAB, Women Health Tech, yay. So.
Love it. Well, maybe to start things off, would love if you can share with us a little bit more about your background and kind of the journey that led you to this point here at Google.
Thank you, Nina. I lead, as you were mentioning before, the global healthcare strategy and solutions for Google Cloud. I came to Google around 5 years ago through an acquisition from a startup. As an apogee, it was a very big acquisition from a tech company to a big tech, but I came into that startup through my work at Kaiser Permanente.
Nice.
And I know you work there. So going back, I've done my bachelor's and master's in computer science from India, came to this country in 97, started my career in the fintech, and then pivoted later to healthcare almost more than, I think, 13, 14 years ago. So my advice to women, there's not a straight line. I started as a programmer, went to fintech, and then healthcare. And now I'm at a place where healthcare is so close to my heart and very rare when your passion and profession align. So that's kind of the long-winded journey, if you will.
That's incredible. Yeah, it seems like definitely a really fun and very robust journey kind of from fintech up until healthcare. That's incredible. Can you tell us a little bit more about your current role and the work that you do with Google Cloud?
Sure. Google Cloud, as you know, is a hyperscaler. So we are working. So I'll step back. Our mission for Google overall, it was started by the founders more than 23 years ago. It was to make wealth information and make it accessible and useful. And in healthcare, when cloud was starting, our focus is very much on to the enterprise customers. So think of this when you are looking into when Google has built over 8 products that are over 1 billion users each, and you use those products as an example, YouTube, search, maps, taking the infrastructure that is leveraged by our own products. We package it, we call it Google Cloud, and we believe we have these tools that we can now take to the industries. So I'm responsible for, as an example, healthcare health systems. Similarly, I have colleagues in retail, telco. We believe we can be very helpful in industries' digital transformation. And in Cloud, I'm focused on building those products and solutions which are very industry specific in Google Cloud. Second part of my role is around industry partnerships. So I led our Mayo Clinic partnership, Well partnership. So because these partnerships are cornerstone for us in how we think about solutions. And third is having that 24-month kind of roadmap as to what capabilities we will build. In this case, we bring a lot of alphabet capabilities within Google Cloud.
Wow. Sounds like a very multifaceted role.
It's definitely, it's a handful.
I love it. Well, I'm so excited that, for me, I'm very excited to be able to talk to someone that really, is so entrenched in kind of the big data and the AI, just all of those capabilities. Um, I think we've kind of heard them as buzzwords, but are now really seeing how they can be very, very useful. So kind of wanted to get from your experiences, and I think even through with your partnerships with other clinics, what are some of the applications that you're seeing, specifically when it comes to AI and big data in a healthcare environment?
That's a great question, Nina. And if you look back past 18 months or so in COVID, we all are all different, right? We are seeing our doctor more and a telehealth perspective. Our kids, I have two daughters, they're taking hybrid classes. So the world pivoted from what used to be a brick and mortar to kind of hybrid and digital approach. And what we're seeing in healthcare, it's kind of almost 10 years worth of progression, big shift in the mindset.
Mhm.
And and there's a shared purpose, and we believe data is our heart of it. We all saw leading with science, leading with data. And so we believe we have launched healthcare data engine that in healthcare, there are two problems with the data if you look into it, right?
Mhm.
It's complex and the many structured elements, there are many unstructured elements. We still have fax machines as an example in the healthcare.
Mhm.
How do you take the wealth of data that has been generated through this unstructured form and make it meaningful and useful, again tying back to our mission, but
Right.
also wealth of information in structured information in EHR. In
Mhm.
now we're talking about wearable technologies where your data is not just your clinical
Right.
information, is where you live, where you eat, your sleep, your activity, your nutrition. All that has to combine to define that health. And
Mhm.
underneath, that's all data, and data
Yeah.
needs to be combined. And it's a hard challenge. And
Mhm.
so we think of that us as kind of Google Cloud being the plumbing. So we lay the pipelines, we get the data, we harmonize it, we normalize it, so that folks can then innovate on top of a cleanse normalized in a nice data layer. And that
Right.
is hard, is complex, is boring.
Mhm.
That's what we do best, and that's where we want to add value in the ecosystem.
That's incredible. I was actually just going to ask you about if you have seen any challenges about, being able to scale all of these new solutions kind of in these existing healthcare structures, that are a little bit clunky still and very fragmented. And it seems like the answer is yes.
Absolutely. So if you look into a typical health system, the more than 5+ kind of
Hmm.
systems of record. Sometimes your labs are in one system, your EHRs in another. In a typical big health IT, there's
Hmm.
a lot of different, not just vendors in place, but also different data structures. So your imaging is sits in packs, your genomics in completely different format, your HL7 messages in
Hmm.
EHR, be it Epic, Sun, or Athena, everyone has a kind of different data ontology.
Right.
Then the big challenge becomes, can we standardize on a standard? That one standard I'm very passionate about is FIRE. So
Hmm.
for the innovators and the listeners, definitely if you're thinking about creating new innovations, if you're thinking about creating new applications, definitely leverage the open standards like FIRE. There's a lot of community support behind it. Two benefits that you'll be able to then take it and plug it, your innovation, to the healthcare ecosystem. And
Hmm.
similarly, if you're building a healthcare ecosystem and part of an organization, think of standardizing that so that you can innovate with the ecosystem. So both ways.
Right. Right. It's like prioritize the infrastructure component of it, and like some of the processes pieces first. That sounds about right. That's
Yeah.
incredible. You had mentioned a little bit earlier, but wanted to know, what are some of the recent projects that you've worked on, or some projects that you're currently working on, that you're really passionate about?
So last year, as I was mentioning, we saw telehealth as a new paradigm in how healthcare as an industry is really adopting and embracing telehealth, virtual health. So one example I'll give you is we partner with a company, and well, they are incredible partners, and they are a telehealth organization. So here's where imagine a telehealth experience where your physician speaks English and the patient on the other side is speaking Spanish. So
Mm,
Google has world-class translation capabilities. So we are doing embedding that translation live within that telehealth experience, and not just closed captioning like you see on the TV, but
right.
also transcribed in a different language, as patient and physician are kind of having the conversation. Language is a huge barrier when we're talking about health equity, when we're talking about different populations. We
Hmm.
believe tools like this can really help
Yeah.
in bridging that gap.
Yep. That's incredible. That sounds like it's going to be, it's like a very simple but very powerful tool. It sounds like that is so incredible.
Another example, which is slightly complicated, that I'll give you the work we're doing in Mayo Clinic. So, Mayo Clinic, as you know, is the world leader in clinical excellence, and
Mhm.
they treat in rare and complex diseases. And they have one of the really powerful high proton beam therapies. When you are diagnosed with a cancer,
Mhm.
most cancers go through this radiation therapy as the first line of treatment. They're given radiation.
Right.
Today, to give that radiation, the tumor has to be identified from the healthy tissue, from your CT scans or MRIs, and a specialist goes in and marks that area, and it's
Mm,
called clustering of the tumor. It's today's a manual process. What Mayo has been able to do, leveraging technologies like computer vision, train a neural net in identifying and contouring, we call it auto contouring,
wow.
and assisting the radiation therapy specialist to contour the tumor. Now, what helps truly is if it takes less time, more people can be seen. And don't forget, in the other part of the world, there's not as many radiologists to begin with.
Yeah. Access issue.
There's access issues, there's assisting the current workflow issues. So in this case, that's what they're doing with head and neck cancers.
Right.
Again, application of AI machine learning in this kind of more setting. It's not diagnosing, but it's more assisting the staff there.
Wow. That sounds that sounds amazing. And then how far along is that project? Is that something that is kind of available to Mayo Health patients right now?
Great question. They are training it. They are
Wow.
piloting it, and in with anything of that nature, it needs to go to a rigorous process in terms of. So that's where they're at. The model is actually being trained. We got the images, and the other example is when you look into AI machine learning, right? It's not just about one model or one
Mhm.
train. What they are also building is a concept called AI factory, which
Mm,
can we make it easy for data scientists, ML engineers to build, scale, deploy
right.
machine learning models? So
Mhm.
we are bringing, we have technology called Vertex AI, and we are provisioning that, and that makes any developer. So you'll have the superpower to be able to do this machine learning pipelines, managing, deploying, and scaling that model. So think of us as an infrastructure slash platform layer to empower your journey in AI and make
Wow.
it easy.
That's incredible. Two other things that I've been hearing about kind of within like an AI and big data landscape are, I think, well, the first one is, things like remote patient monitoring, especially kind of in a COVID world. And then the second is around predictions for health outcomes. Wanted to kind of get your thoughts. Is that something that you've been hearing about, or have you been working on projects related to those two topics?
Absolutely, remote monitoring is top of mind. It's
Mhm.
from a use cases perspective. We today have wearables of all,
Yep.
they're EKGs, heart rate, blood pressure, you name it. I
Hmm.
think where the complexity will come, and it's already coming, it's very hard to manage this data
Mm,
velocity.
right.
And when you are, at the end of the device, at the end of an app, there's a patient on the other side.
Mm-hmm.
Can you collect this data harmoniously, make sense of it?
Right.
And that's where you'll see a lot of AI development in understanding the patterns with this data collection
Mm.
on the remote monitoring side. So think of disease specific cohorts and disease specific algorithms. So, for example,
Right.
if you're diabetic, can I give you a glucose meter and a weighing scale and manage your pattern, understand your behavior, and say, oh, yeah, you now it's an anomaly detection.
Mm-hmm.
Aashima. And same thing when you're
Yeah.
dealing with, like, let's say, congestive heart failure. It's
Right.
completely different set of parameters. So wearable as in general is a broad category, but within that there are verticals
Yeah.
that target a disease. And I think that's where we see a lot of AI and machine learning in, again, harnessing and identifying the patterns.
Right. Right. Wow. Yeah, I could imagine, especially, in this type of world, I think it's really great because not only is there so much more of the capability, but I also feel like for a lot of, patients, there's a bit more of an appetite towards virtual, or maybe in the past they kind of preferred, right, that brick and mortar, or shied away from technology. So I think we're definitely at an inflection point. And then, oh, go for it.
No, go for it.
Oh, I was just gonna say, kind of on that front, when we really think about all of the change and really just the environment that is prime for innovation, what are, for the folks in the audience that are innovators, that kind of are looking to build solutions, from your perspective, what are some of the key ways to impact healthcare, and what are the resources and tools that that we should be looking into to advance?
Great question, Nina. So I'm a big believer in outside-in approach. So if you're
Mhm.
thinking of building a tool and application, healthcare definitely needs it. Getting that perspective from the industry, we see four areas. One, as we talked about, telehealth and remote monitoring is one pillar. A
Mhm.
lot of new innovations. I do believe telehealth as we know it, 3 to 5 years from now, it should look a lot different. It
Yeah.
should not just be a
So.
digitalized patient visit. It is, can we make this better?
Mhm.
It, I gave you the example of translation, very simple example.
Yeah.
The second is, can I scan my insurance card on a telehealth visit and you do the kind of pre-auth through an API? Again,
Mhm.
there's many, many ways this experience can be augmented. So that's pillar one. The second pillar that I see is around operations.
Mm.
Most of the workflows in many enterprises begin and end with a document.
Right.
And there's tons of wealth of information that is buried in PDFs and faxes and documents. So we have technologies like Doc AI where we are creating document specific parsers.
Right.
So as an example, when we all got the vaccine cards, initially it was all paper
Mhm.
to get that information out. That means someone has to process that document, understand the NLP, gain the insights. We're seeing that in healthcare documents. We talk about claims. We're talking about,
Mm.
can we help with the claims process automation
Right.
with technology like that? So we have building blocks in AI. So NLP, this is our document AI as document understanding. That's the second one. In
Mhm.
really going into the operation side of the house and
Yeah.
automating it. The third pillar that I see is around research, where we all saw a vaccine made available in a record time.
Yeah.
We all saw how important it was at that time, the speed. And we will see that continuing on, getting
Mhm.
more public data sets, more interest in. And I do believe cloud naturally lends itself to that elasticity. When I
Mhm.
need research, I want to spin off and process of high volume data. And I think that's where cloud is a natural fit, but also then machine learning and AI, finding
Right.
patterns. So you will see a lot of focus now on the AI in the drug discovery, in research and development. That's the third area that I see. We will see a lot of advances in the next 3 to 5 years.
Mhm. That's incredible. That sounds like a lot of really, really, promising change, and I think much needed change. For, and I'm also kind of curious, when we think about all of the work that's been happening, have you noticed any maybe organizational or even cultural shifts in the way that big data is viewed in healthcare, especially now that we've seen just how much it can do, and just how much it has been able to really be that glue that held healthcare together kind of, in this past year?
Great question, Nina. As I reflect back, what I do see is a major shift in the mindset.
Hmm.
And the mindset meaning people much more willing to share data. We saw during pandemic, a lot of pharma companies kind of came together in
Mm,
labs-based sharing. So that ecosystem sharing is very important.
yeah.
We worked with HCA in the peak of the pandemic, where they were working with thousands of hospitals to create a portal, which is
Wow.
how many beds are available in which zip code, what is the ICU capacity, what is the ventilator capacity. Now, if you want to develop well, it needs cooperation and partnership from
Mhm.
many health systems in sharing that information. And we saw that
Yeah.
at, in that level of collaboration is very inspiring to me.
Hmm.
And I'm hoping that will continue on and we'll find new ways to work with each other.
Yeah, that's so incredible. And yeah, I think so too. I think we've definitely been able to see kind of a lot of how there can be so much good in kind of the coming together. What I also kind of wanted to get your thoughts on too is, really and you touched on this a little bit, this, the need for more health equity. I think, what we've seen is that before technology was kind of a nice to have, but now it's kind of transitioned to like a need to have, and kind of like a lifeline when it comes to a lot of things, but healthcare especially. What are some of the projects that you're working on, or some of the things that you're seeing that will really make an impact from a healthcare access and equity standpoint?
That's a great question, and this is a really top of mind for me and my team
Mhm.
currently. Is what could we bring to the table, and how can we really impact with the health equity initiatives?
Yeah.
We are seeing, as you mentioned, the machine learning could play an important role in both. We saw the research side, but also to really go into the vast data sets and,
Hmm.
and identify health equity. A zip code should not define, we all say that, about your health outcomes, but we
Right.
all saw COVID highlighted that.
Yeah.
Now, how do you build up proactively to understand the bias that exists in your data sets?
Hmm.
Understand who is that high risk category, and then tailor the interventions. So, A, we are bringing forward public health data sets.
Mm.
It's a big investment
Yeah.
for ecosystem for each one to look into the census data, CDC data. So we have John Hopkins data as an example. So
Hmm.
we are working with the community to get this data set hosted on Google Cloud,
Right.
so that when you're building an application like that, it's easy for you to lean on that data because it's already cleansed, made available, and that's our investment. So that's one part.
Hmm.
The second part, that visualization is important. So we have tools like Looker. Can you imagine a dashboard where you're seeing, okay, in this zip code, who's my most vulnerable population,
Wow.
and how do I address it? So that visualization, we are um, working with a few health systems and creating those kind of dashboards. But the third is, after this dashboard, there needs to be intervention.
Hmm.
And imagine a physician seeing a woman, a mother on the other hand, who's going through pregnancy, which is high risk, but she's also has food insecurities.
Right.
Can we then do the intervention? Again, I'm wearing more kind of technology hat here.
Hmm.
That physician knows the context when he or she is seeing the patient.
Hmm.
And that means now not only I have to connect your EHR data, I need to understand your social needs.
Right.
And then it needs to surface in a timely manner for that encounter during that episode.
Hmm.
So a lot of technology underneath that can happen, that can connect the dots and bring that information forward, so then they can do the right thing.
Right.
So these are kind of three things which we believe you will see more on the data set side, on the dashboard visualization side, and then enabling the interventions. So that's kind of how my world of health equity looks.
Wow, that sounds incredible. And I think just the concept of really being able to view patients, from that holistic manner and kind of taking in all of their needs, not just, the physical, the clinical, I think sounds like a blueprint for, I think, an even better healthcare. So that I am fully behind that vision. Perfect.
Okay.
Yeah, well, to kick things off, I know we're kind of close to the end of our time together, but before I have you go, just really wanted to kind of end things by asking you if you have any, words of advice or nuggets of wisdom for folks that are healthcare technologists or kind of looking to, play a bigger role in that space.
Sure thing. I would say, first of all, healthcare needs all of you, your passion, your innovation. So we need more people in healthcare in general.
Mhm.
And my advice that I received, which was focus on a few things. Healthcare is complex, very big, multiple different parts in the value chain, but understanding where you can have the impact is
Mhm.
so I would say uh, I see sometimes our efforts get too scattered. So the best advice that I have received for myself, and I still kind of practice it, what are the very, very few things that I can do? And you will see in your portfolio, 20% of things will have 80% of the impact. So
Mm.
identifying those and channeling your energy to a few things, but doing them well is important. The second is for the women listening here, take risks. I can't stress enough. This is kind of my advice to my younger self as well. I wish I could take risks. So just go out and do it, and don't be shy. Bet on yourself. If I have to give that advice.
I love that. That's perfect. It's a great way to end. Bet on yourself and take risks.
Awesome. Thank you, Nina.
Thank you so much for taking the time to chat today, Aashima. I had such an incredible time just learning more about, I think, kind of the big data aspect of healthcare. Just want to tell everyone know that next week we also have our Women's Health Tech Wednesdays meeting with April. So please be sure to tune back in next week. And then also wanted to kind of further just remind everyone, for those that hopped on a little bit late, to register for our research studies. All of the information is in the chat. We have 2 studies going on, so please be sure to check those out. And then also wanted to remind everyone that applications are still open for the Health Tech Challenge. They close on the 20th of this month. To get all of this information and more, please stay in touch with us on our social media channels. And then also really just wanted to thank Aashima again for an amazing conversation. Thank you so much for taking the time. I had a blast.
Thank you for having me, Nina. You are a great host. Thank you.
Thank you. Wonderful. And thank you to our sponsors, Goodwin and Witham, for sponsoring this conversation. All right, everyone, have a great rest of the week, and see you all next week.
See
Thank
you.
you.